So like other viruses, the COVID virus does change over time. And what we are concerned about, and that's why we call it a variant of concern, it's whether any of those changes make the virus more harmful to us. So what do we mean by more harmful? Is it more infectious? So does it transmit more easily from person to person? Does it actually cause more harm? So are people more actually seriously ill when they get this version or new variant? And finally, does it actually have any impact on how we use the vaccines? So is it immune, if you like, to the vaccine? Now, so far what we found for this variant, the Indian variant, the one we call B1.617.2, is that on transmission, we think it's a little more transmissible. We don't yet know how much. There are different estimates of that. There's no evidence at all that it causes more harm, none whatsoever that we've uncovered so far. And as a PhD study's recently shown, the vaccines, of whether it's AstraZeneca or Pfizer, are very, very effective against this variant when people had 2 doses. Hence the purpose of the recent acceleration of the vaccine programme to get as many people as possible to have the 2nd dose.
Dangerous.
Well, first of all, what I wouldn't want people to be at all is to be complacent about this variant or any other variant. We must remember that the original variant we had of COVID, then we had the so-called Kent variant, now we have this variant, the Indian variant, the B1.617.2 variant, we've had South African variant, we've had Brazilian variant. They're all serious. So we mustn't be complacent, first of all, if it's around other variants and just worry about this variant. On this variant, this Indian B1.617.2 variant, there is no evidence at all that people who catch this variant are more seriously ill than catching other variants. So there's no evidence of that at all so far, and that's very, very encouraging. We also have very good evidence that with 2 doses of the vaccine, that is very effective to give people protection against the B1.617.2 variant, as it does against all the other variants so far. Yeah. Well, the way to stop the spread of the B1.617.2 variant or any other variant is exactly the same as we've known now for 15, 16 months. The virus spreads in close contact between people, and it's more likely to spread in confined spaces than it is outside. So, therefore, in order to protect ourselves, we should only be mixing still really in close proximity to people who are in our bubble. We should still be wearing face masks indoors in shops and on public transport as we're requested to do. We should still be very careful washing our hands all the time in terms of surfaces that we touch. So hands, face, space are all very important. And we should still remain vigilant and cautious. This virus has not gone away yet, but there is now enough reduction, if you like, of the amount of virus in the population for us to be able to do things more safely in careful circumstances. But we have to be careful still. We still have to be careful and to be cautious until we get the entire population vaccinated and we get the transmission rates and the infection rates at very, very, very low levels.
And other variants.
Well, this is a critical question. The whole issue of vaccine effectiveness, and it's at the heart of our strategy to combat this disease. And thank goodness so far, all the evidence that we have, and we have real life data now on tens of millions of people. It's not just the original clinical trials and the lab studies, but the real world data is showing that the vaccine is effective against the current variant, which is floating around, the Indian variant, and all the other variants. And by effective, what I mean by that is it's having a massive reduction in the number of people who are dying due to COVID when they're infected. It's having a massive reduction on the number of people becoming seriously ill and going to hospital. And it is also reducing the ability of the virus to pass from one person to another. So in other words, people who are vaccinated with 2 doses are less likely to pass on to other people. It doesn't mean they can't pass it on to other people. It doesn't mean people can't get the the virus if they are double vaccinated. But what the evidence is showing us is that if that does happen, then the harm is very limited and that they are less likely to either be infected or to infect somebody else. The vaccine programme is an incredible achievement and it's hugely important. I mean, thank goodness, so far in the North East, we've had a fantastic response from the public. We have very, very high rates of the vaccine, which none of us thought we would achieve. So we have had a tremendous response to the vaccine across all age groups. That's the first thing I'd like to say. So a huge thank you to the people of the North East for that. Secondly, we're also finding that the follow-up dose, the second dose people are getting, the take-up is still huge as well for that. Because there was a concern that people might have one dose and think, I don't need the second. Well, thank goodness people do understand the message. They're coming forward in their tens of thousands and hundreds of thousands for the second dose as well. And that's fantastic news as well. Because a vaccine does two things. It protects yourself, but it protects the rest of us. It protects the people you live with, your friends, the people you live with, your loved ones, and it protects society as a whole. So I would urge anybody who's not yet had the first dose of the vaccine, who is eligible, please to come forward to protect yourself and to protect society and protect your friends and loved ones. The vaccine is safe, it's effective, it does what it says on the tin. It stops people dying from COVID, and that is critical. Yeah, testing is a very, very important part of how we're actually tackling this pandemic. So first of all, for people who have any of the symptoms, so that's a temperature, a loss of sense of taste or smell, or a continuous cough that develops, then you really should isolate and get a test. And the test you should get in those circumstances would be a PCR test, because they're the tests that are the ones that go to the specialist labs, if you like, and which are the most accurate. We also have available a huge supply of what's called lateral flow devices, so the more portable tests. They are still very reliable tests, and they give a good indication of people who are positive if they have a high viral load, particularly of the virus, and more infectious. And it's really important that we find those people and help them to understand they have COVID and to isolate. We're also now doing a lot more testing of people who are contacts of cases, because that gives us more of a picture for people for us in terms of understanding the spread of the disease, and it finds more cases. And it's critical if people are tested positive or if they're a contact still, that they should isolate for 10 days until their symptoms are clear.